So this is Perry. Perry I'm so proud of because he had severe arthritis in his back in terms of he had it used to take you 20 minutes to get out of bed in the morning?
Some morning, 20 minutes, scratching, bending, just using my scraps to pull on just to get myself loosened up and go to work.
Right. So he was in a lot of pain. He kind of walked in here like this about a week and a half ago, right? So whenever I see arthritis, I have people do, if they're willing, a juice fast and then switch to a whole food plant-based diet so juice fast for 3 days and then a whole food plant-based diet. Now, so you had, what was your pain level when we first started a week and a half ago?
I would have to say at least 8.
An 8.
Yeah.
He was in severe pain. Now, what's your pain level?
It's between 3 and 4.
3 and 4. So you cut it in a little bit more than half and you pop out of bed in the morning, you said, right?
Out of bed with no problem, unbelievable getting out of the bed each morning. Just, for years I just struggled getting out of bed.
Right.
And now I get out of bed with ease.
Okay. So he has a little bit of pain left in your back, right? So go ahead and bend for me and tell me at what point you start to feel it.
I'd say about right there.
Right there? Mm-hmm. And then point to me exactly where. So you can come over here.
Right here.
Right in there?
Mm-hmm.
Okay, then come back up. So go ahead and turn and face that way over here.
This way?
Face there. So here and here. So what I'm going to do is, I'm going to stimulate a point in the back of his thigh here that connects into here. So you said your pain level was a 3 to 4 when you bent over?
Yes.
Okay. So I'm going to stimulate right in here. Let's see what happens. So this connects to his back with his leg like this, with 0 degrees of dorsiflexion. If you were to, do it in plantar flexion or increase the dorsiflexion, then it wouldn't connect anymore because the fascia shifts down like that. So it would have a different connection. The connection would be down like that. So angle of pressures matter. Patient positioning matters. Now go ahead and bend for me, Perry. Better, worse, or same?
It's better, but I'm bending a little further.
Yeah. Is it still there?
It's just a little.
What number would you give it?
I give it about between a 2 and a 3.
So down a little bit from a 3 to 4 to a 2 and a 3. Now point to me exactly where.
Right here.
Okay, so if you notice, come back up, Perry. So you notice he pointed here before, these 2 points, but he's not pointing there anymore. He's pointing here, which is a different spot for me. Okay, that means something to me. So what I'm going to do is move over to the middle here. So these are off switches for 1 millimeter of the body. And if you miss that 1 millimeter, then you're not going to hit it. Now, let's see what happens. Go ahead and bend for me, please.
Oh, wow. That's crazy. Yeah.
Is it still there?
Yeah, just a little. I felt like it's about a 1, but look how far I'm going all the way down now.
Right. So it's a 1 now.
Very, very little.
Okay, now point to me with your fingertip exactly where.
Let me do it again. I would say right in there.
Right there. So, and then back up.
Mm-hmm.
So I think I hit that spot. So what I'm going to do is move to a different area of the body. So I'm going to move up here and see if I know I hit that spot and it didn't work, or we didn't get it all the way, then I'm going to move up here and stimulate. That connects here, down into your low back. And now, go ahead and bend for me.
Oh, wow.
What do you got now?
Just a little soreness, but it's partially what we got with the exercise is probably gone, but it's pretty good.
Is it pain or is it
No, it's not pain.
or is it a tightness or
like a little tightness.
no tightness, but the pain is gone?
The pain is gone. There's
Okay.
no pain. It's just like tightness.
Right. So when I teach, I have this slide that says there is a word, and people say it's tight, it's sore, it's hot, it's numb. But as you can see, he's got full range of motion. If you ask him the phrase, "Do you have pain?" Would you call it the word pain? He says no, and at that point, right? And you said no, right?
Right.
And at that point, I'm done, and that's I think it's like a nervous system thing. You know that there's an injury there, and then that starts to resolve. But the pain's gone, and he increased his range of motion. And go ahead and extend back for me.
Mm-hmm.
What about that?
There's no pain there.
So no pain. And he has arthritis in his spine, so you'd expect that would hurt, but he doesn't. So just has a little bit of tightness or soreness there.
Right.